Well, good afternoon. It's really quite challenging to follow three such dynamic speakers. But for those of you who know me, you know that you'll get some content and an occasional smile. And so I am happy to be here. Actually, I want to start with a quote from Donald Schwartz with the Robert Wood Johnson Foundation when he challenged us to think bigger. And that is that we can have a society where no children experience trauma. And so we have collectively decided that we accept that challenge. And so what I'm going to talk about today might be characterized as Building Strong Brains 2.0, but I do think that it makes sense to go back just a little bit, because as with Fingertips Parts 1 and 2, the song that I chose, I do think that a really good future for Tennessee and for our children is at our fingertips now. But as you know, Building Strong Brains is that array of public and private sector activities to address, prevent, and mitigate ACEs. Everybody knows a lot about them, that if they occur with sufficient duration and intensity, that there are very likely going to be brain impediments to brain development, and then potentially health problems as adults. And so we know that it's important, and we have focused on prosperity of the state, the future prosperity of the state being how it is that we can create an environment for the optimal well-being of this generation coming on board now. And so then I will say that you're going to be familiar with this, but it's a relatively new depiction of how we've tried to describe our mission. And that mission is to change the culture so that the overarching philosophy, policies, programs, and practices are for use the most recent brain science for advancing the position of children, youth, and young adults, and preventing and mitigating ACEs. There are many sectors that can contribute to the overall opportunities for children, families, and communities to thrive when they're all directed toward the most promising practices that are available. With Building Strong Brains, we've been in that unique position where we've really gotten to fund and support innovation. I was talking with Mary Shelton earlier today about something that TennCare is going to do on behalf of Building Strong Brains, and said, we are in that unique position where we're able to test the small tests of change and say when something needs to be adapted. I see Emily Parton here at the front table, and with the things that had been initially proposed in Grundy County didn't go exactly the way one had thought because of the delay in the data on which they intended to work or to rely. We were able to change that. So it has been just a tremendous opportunity to innovate, and we want to do more of it. And so what I want to do now is point out some of the characteristics of what I don't think we'll call BSBTN 0.20. However, we do consciously adopt the extended ACEs pyramid because we know that with the well-established conditions of abuse, neglect, and household dysfunction, we do need to add to it. And Renee, you and I can have a conversation, and others, about including poverty, bullying, and racism as ACEs. One of the things that we heard Al Race say at the summit in 2018 was that if you lift children out of poverty, and even with their family intact, the likelihood of their succeeding is far greater than if you don't lift children out of poverty. And then we do know, though, that to the point that you make, Renee, that recognizing the intergenerational effects of ACEs, that we are addressing ourselves to the historical trauma and social contexts affecting people's outcomes. We know from science that trauma can be transferred from generation to generation. So the vision of Building Strong Brains Tennessee remains very much the same, that every child in Tennessee will have the opportunity for a healthy, productive life. Children thrive in safe, stable, and nurturing environments and supportive families, caregivers, neighborhoods, and communities. However, we want to go further with what we are able to accomplish with science-based advancements in building responsive relationships, reducing sources of stress, and strengthening core life skills. Al Race, again, at the summit in the last fall, pointed out that there is new science, and that now you can look at the brain down to the molecular level and see how interactions occur. And so we need to infuse this new approach to evaluation of programs, and it can be done by asking, what about the intervention works? How does it work? For whom does it work? And for whom does it not work? And so as we go forward with the work, we also want to think about what is referred to as a pair of ACEs. How many of you were able to be at the summit last fall? All right, then some of you did see when Donald Schwartz did talk about the collaborative ACEs. So this is a new take on a figure that many of you have seen, in which typically where typically one would have the ACEs that we are all very familiar with of adversity, and then below the root problems that one might be dealing with. What this tries to lay out as a pair of ACEs is something that I think will guide our work going forward, and that is through collaborations, which may be unusual in their nature because of who's at the table, we'll actually be able to address the come to grips with having children's health care, the public health systems, and really see some resolution and improvements in those areas, in part by dealing with some of the root causes of problems today. And so what we're looking at is that we think that by fostering community investments to advance the social determinants of health, that is social environment, physical environment, health services, and structural and societal factors, that we will be able to address, think bigger, and solve more problems. We know that the social determinants of health are influenced by the distribution of money, power, and resources. So we need to pull a lot of new resources together. It is also an opportunity, we think it's timely, to consider the social determinants of economic security. Those factors include the items that you see in this figure, which are health and wellness, neighborhoods and built environment, civic infrastructure, social and community context, education, living wage jobs, and racial equality. It's been a long-standing value of BSBTN to assure that the future prosperity of the state is promoted by having high-quality supports and services for children caretakers and their communities. But the specific inclusion of youth and young adults in our mission statement suggests that it really is time that we think newly about the social determinants of economic security and a new way to formulate new approaches to old issues. I'm very impressed with what this administration is promoting already, with having skill building and training for young people so that they will be employable. And at the same time, if we do not take into consideration the social determinants of children and youth who are going into that set of learning experiences, as well as those who are going into higher ed and academia, we'll be missing the boat. So we really want to work cooperatively with all of those who are looking to improve the economic security of Tennesseans. And then I want to go back to this for just a moment, because we do think that with thoughtful and innovative collaborations, BSBTN can contribute to the larger efforts. With the larger efforts of isolation and otherwise enrich by prompting opportunities for learning and community action. we must begin to consider not only the important and significant essential elements of social supports and interventions, but to build resiliency, also to move to the not so typical collaborations that move forward opportunities for communication and learning in more prominent and potentially less costly ways through new uses of public resources, for example. We might be able to do this often through play in supermarkets, bus stops, parks, and park benches, for example. We can collaborate with housing authorities, city planners, among community organizations, senior citizens, and employment services as we strengthen the 2-generation and 3-generation approach. It really has to be a full frontal effort to address these matters. So how will that happen? And I think that basically it will be through the continuation of what we've referred to as knowledge mobilization. Part of that was done in conjunction with the Frameworks Institute, without whose partnership we would not be where we are at this moment, which is among the leaders in the nation on this work. But also, as the information that we learned with Frameworks has spread, and I don't think you can even call it trickle down. It has penetrated the state. I think we owe TCCY and some of my colleagues in DCS a real debt of gratitude for going the distance with now having, I think it's 595. How many people have been trained for trainers? 900 and some. And the reach is right at 40,000 people. That's pretty huge. So when you've got that number of people who are all looking through a common lens at what some of the issues are, even from their different vantage points, we know that that really is mobilizing. And so now it's interesting that when we started with this effort, we conceptualized that after people went through training, they'd go back to the localities and communities and come up with community action plans. And so what we see happening now is that's exactly what's happening. And so the way that we'll continue to make a difference is to say, please come to the table. We know that we need every voice. Every voice is important. And so we've had many, many successes during this several years of effort now. And so while we do have greater focus in this 2.0 on the historical trauma and social context, the approaches to reduce the community conditions that contribute to or are ACEs, and the social determinants of health and economic security, I do think that it's probably appropriate to take just a moment to revisit the goals. Because they've withstood the test of time so far, and they are in brevity to continue to increase public knowledge about ACEs, impact public policy to support prevention of ACEs and the community conditions that contribute to them, to support innovative local and state policies that offer fresh thinking. I think that with starting to think bigger, as we are encouraged to do, we'll find ways to have innovations that are really fresh and to bring promising practices that have been tested in Tennessee to scale. And then to certainly engage the business community to be partners who understand that there is a return on investment. It's been thrilling to hear all of the comments that have been made today about the interactions of those of you who have presented and who your allies are. It was very important to hear this morning about having childcare on site and having businesses understand that that's a really important facet of having a good workforce. So I would say that for all of us who get to help guide this work, we thank you. It's pretty remarkable. And then for myself, I say, this is a privilege. But I will say it was sufficiently stressful to have to move this talk from tomorrow midday when I would have had it. And so to the extent that nobody really has talked about, moderate stress, toxic stress, I thank you for your indulgence today. And really thank you for helping to move that culture from what's wrong with you to what happened to you.